If your legs suddenly feel weak, heavy, or like they might buckle underneath you, I want you to pay close attention to what I'm about to share with you, because this particular symptom, after age 70, deserves your attention. Now, I'm not here to alarm you, but I am here to help you understand what might be happening, and more importantly, how to communicate it clearly to your doctor so you get the answers and the care you need. In just a few minutes, I'm going to walk you through a 60-second self-check you can do right there in your chair to gather useful information about what's going on with your legs. I'm also going to share 3 specific red flags that tell you this needs urgent attention, and I'll give you the single best sentence to say to your doctor when you call or walk into that appointment, a sentence that captures exactly what they need to hear. So stay with me through this entire video because the most actionable information comes near the end, and it could genuinely make a difference in how your next medical visit goes. Before we dive in, let me ask you to do something quick. Drop a comment below with your age and where you're watching from today. Now, let's talk about what we actually mean when we say sudden weak legs, because this phrase can describe several different sensations, and getting clear on what you're feeling is the first step toward getting the right help. Some people describe it as their legs feeling heavy, like they're wading through thick mud or dragging lead weights with every step. Others say their knees feel unreliable, like they might give way without warning, even though they haven't actually fallen. You might be someone who can stand just fine but finds that walking feels unstable or uncertain in a way that's new. Or maybe you've noticed that your legs tire out dramatically faster than they used to, where a walk to the mailbox that used to feel easy now leaves your thighs burning and your body begging to sit down. Any of these sensations, when they come on suddenly or represent a clear change from your baseline, is worth investigating. And the reason I emphasize sudden is because gradual changes over months or years often have different causes than weakness that appears over hours, days, or a couple of weeks. What I'll be sharing with you today focuses on those more sudden or recent onset situations, the ones that tend to worry people most, and the ones where timely medical input matters. Let me paint a picture for you that might feel familiar. Imagine you're getting up from the dinner table after a normal meal, and as you push yourself to stand, your legs feel strangely heavy and unreliable. You make it up, but there's a wobble, a moment of uncertainty you don't remember having before. Or picture this. You're walking through a store, and halfway down the aisle, your legs feel like they've run a marathon, even though you've only been walking for a few minutes. Maybe you woke up one morning and swung your legs over the side of the bed, and they felt oddly distant, almost like they weren't quite yours, like the signal from your brain wasn't reaching them the way it should. These scenarios are more common than you might think, and they often have identifiable causes that your doctor can investigate. In a moment, I'm going to walk you through 7 of those causes, and I'll tell you exactly what clues to look for and what to mention when you talk to your healthcare provider. One of the most frequent culprits I see in my practice involves medications, and I want you to hear me carefully on this, because it's not about whether a medication is good or bad, it's about whether something has recently changed. When a new medication is added, when a dose is increased, or when the timing of an existing medication shifts, that change can affect muscle strength, energy levels, or even how well your nervous system coordinates movement. Certain blood pressure medications can cause weakness or fatigue, especially in the period after your body is adjusting to them. Some sedatives, sleep aids, or medications for anxiety can leave your legs feeling less responsive than usual, almost like they're moving through water. Diuretics, sometimes called water pills, can shift your fluid and mineral balance in ways that affect muscle function in ways you might not expect. And here's something that most people miss. It's not always a brand new prescription that's the issue. Sometimes it's a dose adjustment, or it's the interaction between 2 medications you've been taking separately for years that now, for some reason, are affecting you differently. Perhaps you added a supplement, or your pharmacy switched you to a generic version, or you started taking something at a different time of day. These subtle shifts matter. This is exactly why, when I give you that sentence template for your doctor in a few minutes, it specifically includes medication timing. If you've had any medication changes in the past few weeks, and you're now noticing leg weakness, That connection is something your doctor will want to hear about right away, so please don't leave it out of the conversation. Another cause that many people overlook is how powerfully an infection or acute illness can affect your leg strength, even when that infection isn't directly related to your legs at all. I've seen patients come in genuinely worried about sudden leg weakness, and after some careful investigation, we discover they have a urinary tract infection or an early respiratory infection that hasn't yet produced obvious symptoms like coughing, fever, or painful urination. In older adults, the body sometimes responds to infection with generalized weakness, fatigue, or even confusion, rather than the classic symptoms younger people might experience. So, if your legs suddenly feel like they can't support you the way they should, and you've also noticed that you feel a bit more tired than usual, perhaps a slight temperature or just feeling off in a way that's hard to describe, that infection connection is absolutely worth mentioning to your doctor. They may want to check some basic labs or ask you questions about symptoms you might not have connected to your legs at all. Along similar lines, blood sugar fluctuations can play a significant role in sudden leg weakness, particularly if you have diabetes or if you take medications that lower blood sugar. When blood sugar drops too low, one of the early warning signs can be weakness that settles into your legs, along with shakiness, sweating, or feeling suddenly lightheaded. But even swings in blood sugar, going from high to low or low to high throughout the day, can leave your muscles feeling drained and unreliable. If you're someone who manages diabetes, think back to whether your weak legs coincided with a time when you might have missed a meal, taken your medication at an unusual time, or experienced any of those classic low blood sugar warning signs. This is valuable information to share with your care team because it points them toward a specific and often easily addressed cause. Now, I'm going to mention dehydration and electrolyte imbalances briefly because they certainly can cause sudden leg weakness, but I don't want to dwell here because I suspect you've heard plenty about staying hydrated. What I will say is this. If you've had a stomach bug with vomiting or diarrhea, if you've been sweating more than usual without replacing fluids, or if you've been taking diuretics and perhaps not keeping up with your intake, your potassium, sodium, or magnesium levels might have shifted enough to affect how your muscles contract and respond. Your doctor can check this with a simple blood test, and if that's the issue, correcting it is often straightforward. But stay with me, because I want to spend more time on some causes that I find often get missed in these conversations, and understanding them could change how you approach your next medical visit. Let me turn now to nerve-related causes of sudden leg weakness. And I want you to pay attention here because this affects a lot of people, and the clues can be very specific. If you have lumbar spinal stenosis, which is a narrowing of the spinal canal in your lower back, you might experience flares where your legs suddenly feel weak, heavy, and tired, especially when you've been walking or standing for a while. The classic pattern that clinicians look for is that the weakness gets worse with standing and walking and improves when you sit down or lean forward, like leaning on a shopping cart at the grocery store. If you notice that your legs feel better when you're seated or bent slightly forward, and worse when you're upright and walking, that positional pattern is a clue worth sharing. Peripheral neuropathy, which affects the nerves in your feet and legs, can also cause episodes where your legs feel weak or unreliable. This condition often comes with additional sensations like numbness, tingling, burning, or a feeling like you're walking on sand or pebbles. If you notice that your weakness comes alongside these other sensory symptoms, particularly in your feet or lower legs, that combination is important information for your doctor. Sciatica, which involves irritation of the sciatic nerve, often from a disc issue in the spine, can cause weakness in one leg along with pain that radiates down the back of the leg, sometimes all the way to the foot. Here's a key question I want you to ask yourself, and be ready to answer for your doctor. Is your weakness one-sided, or does it affect both legs equally? That distinction helps narrow down the cause significantly because nerve compression, for example, often affects one side more than the other, while conditions affecting your overall health tend to cause more symmetrical symptoms. Don't worry, if you're not sure right now, that's one of the things we'll check together in that 60-second self-assessment coming up shortly. Let me turn now to circulation, and I want you to pay particular attention because one aspect of this topic carries real urgency. Generally speaking, poor blood flow to the legs can cause a heavy, tired feeling in your muscles, particularly when you're walking or active, and this often improves when you rest for a few minutes. You might notice that you can walk a certain distance before your legs start feeling fatigued, and then after a brief rest, you can walk that distance again. This pattern, while worth discussing with your doctor, typically isn't an emergency. However, I need to share something more serious with you. If you develop sudden leg weakness or pain in one leg, and that leg also appears swollen, feels warm to the touch, or the skin looks red or discolored, this could be a sign of a blood clot, and that requires urgent medical evaluation. Do not wait for your regular appointment if you notice these signs together. A blood clot in the leg is called a deep vein thrombosis, and if a piece of it breaks off and travels to the lungs, it becomes a life-threatening emergency. So, if your weak leg is also noticeably swollen, warm, and painful, especially if it's just one leg showing these changes while the other leg looks normal, I want you to contact your doctor immediately or go to urgent care without delay. This brings me to the category that I know concerns many people the most, which is neurologic events like transient ischemic attacks, sometimes called mini-strokes or actual strokes. When leg weakness is caused by a stroke or TIA, there are usually other signs happening at the same time, and this is where I'm going to deliver on my promise and tell you exactly what those 3 red flags are. These are the warning signs that mean you should not wait. You should not try to sleep it off. You should not call your regular doctor's office and wait for a callback. You should seek emergency care immediately. The first red flag is new one-sided weakness or numbness, where one side of your body, including your face, arm, or leg, feels suddenly weak or numb while the other side feels completely normal. The second red flag is facial droop, slurred speech, or confusion, where your face looks asymmetrical when you try to smile. Your words come out garbled or jumbled, or you find yourself unable to think clearly or understand what people are saying to you. The third red flag is a sudden severe headache unlike any you've had before, often described as the worst headache of your life, sometimes accompanied by vision changes, loss of balance, or difficulty walking. If any of these 3 red flags are present, along with your leg weakness, this is an emergency. Call 911 or have someone take you to an emergency room immediately, because time-sensitive treatment can make an enormous difference in outcomes. Minutes matter with strokes, and the treatments available work best when given early. I also want to mention that if you experience loss of bladder or bowel control, along with sudden back pain and leg weakness, this could indicate a condition called cauda equina syndrome, which requires emergency evaluation to prevent permanent nerve damage. Please do not wait on that combination of symptoms either. Now, I'm going to guide you through that 60-second self-check I promised at the very beginning, and this is something you can do right now with me if you're seated in a safe, stable chair. Before you try this, please make sure you're in a secure position where you won't fall. This is not a test that diagnoses anything, and it won't tell you definitively what's wrong with your legs. What it will do is help you gather useful observations about your leg strength and symmetry, information you can then share with your doctor to help them understand what you're experiencing. If you're comfortable doing this, go ahead and sit up tall in your chair with your feet flat on the floor. First, without using your hands to help, see if you can lift your right foot off the floor, just a few inches, and hold it there for a second or 2. Now put it down and do the same with your left foot. Did one side feel harder to lift than the other? Did one side feel weaker or slower to respond? Now, still seated, try straightening your right knee so your lower leg extends out in front of you. Hold it there for just a moment, then put it down. Do the same with your left leg. Notice if one leg trembles, feels significantly weaker, or can't fully straighten. Finally, place your hands on top of your thighs and gently squeeze your thigh muscles, feeling the firmness of the muscle on each side. Is one side noticeably softer or weaker feeling than the other? What you're looking for is asymmetry, any difference between the two sides that's new or more pronounced than you remember from before. If you feel safe doing so and have something sturdy to hold on to, like a countertop or a solid piece of furniture, you can stand up and simply notice whether one leg feels like it might give way more than the other, whether you feel stable, standing tall, or whether you need to lean heavily on your support. Remember, this is purely information gathering, not a diagnosis. If you notice differences or concerns during this check, write them down so you can share them with your doctor when you make that call or walk into that appointment. Let me ask you something, and I'd genuinely love for you to share your answer in the comments below. When you experience weakness in your legs, does it feel more like heaviness, like wobbliness, like your knee might buckle, or like sudden fatigue where your muscles just seem to run out of energy unexpectedly? Each of these sensations can point in different directions, and understanding your own experience is part of solving the puzzle. Now, let me give you some additional context that I find helps people understand when to be more concerned versus when something might be less urgent and appropriate for a regular, scheduled appointment. Leg weakness that comes and goes throughout the day, that's somewhat predictable based on your activity level, and that isn't accompanied by any of those red flags I mentioned is still absolutely worth evaluating, but it's usually appropriate to schedule a regular appointment with your doctor rather than rushing to the emergency room. On the other hand, weakness that came on suddenly out of nowhere, that's rapidly getting worse over hours or days, that's affecting one side much more than the other, or that's accompanied by pain, swelling, sensory changes like numbness or tingling, confusion, speech changes, or any of those emergency signs I described earlier, that warrants more urgent attention without delay. Trust your instincts here. If something feels wrong in a way that's unfamiliar and genuinely worrying, err on the side of reaching out to a medical professional sooner rather than later. You know your body better than anyone else, and if something feels different or alarming, that perception is valid and worth acting on. Part of what I want you to take away from this video is that your observations matter tremendously. The details you notice about your symptoms, the timing, the associated sensations, the patterns throughout the day, these are exactly the clues your doctor needs to figure out what's going on and point you toward the right next steps. And this brings me to what I promised you at the very beginning of this video. The single best sentence to tell your doctor when you call or walk into that appointment. This sentence template captures the key information they need and sets the entire conversation up for success. Here it is, and I want you to listen carefully because this approach really does make a difference in how efficiently you communicate and how quickly your doctor can help you. You'll say something like this, filling in your own specific details. My legs started feeling weak on this particular day, which was about this many days ago, and I was doing this specific activity when it began. The weakness feels like this particular sensation, describing whether it's heaviness, wobbliness, buckling, or fatigue. It's affecting one leg more than the other, or it's affecting both legs equally. I have noticed numbness or tingling, or I haven't noticed those symptoms. I recently had this medication change, or this illness or fever, and I have fallen as a result, or I haven't fallen. Let me break that down so it's crystal clear. You're telling them when it started, what you were doing when you first noticed it, what the sensation actually feels like in your own words. Whether it's one-sided or affecting both sides. Whether there are sensory symptoms like numbness or tingling, any relevant medication changes or recent illnesses, and whether you've had any falls. That single sentence, personalized with your specific details, gives your doctor an enormous head start in figuring out what might be happening. If you need to write notes before your appointment to remember all these details, please do that. Your doctor will genuinely appreciate it, and you'll feel much more confident and prepared walking into that conversation. Before I let you go, I want to give you a simple action step you can take right now. If you're experiencing leg weakness, or you want to be prepared if it happens in the future, I'd like you to keep a brief note, whether on your phone, on a piece of paper by your bedside, or even just a mental note to share with a family member, covering a few key things. Note when the weakness started, even if you have to estimate the day or time. Note any recent medication changes, whether new prescriptions, dose adjustments, changes in timing, or even new supplements. Note whether you've had any fever, felt ill, or had any symptoms of infection recently, even minor ones. Note whether the weakness is in one leg or both, and whether it stays the same throughout the day or changes with activity or position. Note any numbness, tingling, burning, or other unusual sensations in your legs or feet. And finally, note if you've had any falls or near falls as a result of this weakness. This information is exactly what your doctor needs to start piecing together the cause and deciding whether additional tests, imaging, blood work, or specialist referrals might be helpful for you. You are your own best advocate, and showing up prepared with these observations puts you in a much stronger position to get answers. If this video has been helpful to you, I'd genuinely appreciate it if you'd take a moment to hit the like button and subscribe to this channel if you haven't already. This channel exists to help older adults and their caregivers navigate health questions with clarity, confidence, and practical guidance, and your support helps these videos reach the people who need them most. For now, I want to leave you with this thought. Sudden leg weakness after age 70 is not something to ignore, but in most cases, it's also not something to panic about. Your job is to observe what's happening in your body, to note the details of what you're experiencing, to recognize those red flags that require urgent attention, and to communicate clearly and confidently with your doctor using the information you've gathered. You are the expert on your own body and how it normally feels, and those observations you make are genuinely valuable to the people trying to help you. If your symptoms are new and concerning, but don't include those emergency red flags, contact your doctor's office and describe what's happening. If you do have any of those urgent warning signs I described, please seek emergency care right away. Either way, don't sit at home wondering and worrying alone. You deserve answers, and there are people who can help you find them. Take care of yourselves, take care of each other, and I'll see you in the next video.